This is Dr. Sachin Varma with over 20 years of clinical experience in clinical and aesthetic dermatology, with about 4 years as assistant professor in a medical college, about 16 years as consultant dermatologist Apollo Gleneagles Hospital, and last 1 year as chief dermatologist and medical director, Skin Vita Clinic, Calcutta. It is one of the biggest skin clinics in Eastern India, which offers complete skin and hair solutions under one platform. Today, I'll be speaking to you about chronic spontaneous urticaria. I keep getting questions on urticaria all my life, and this is a chronic skin condition, keep bothering people. Today I'll be answering questions on chronic spontaneous urticaria. Chronic spontaneous urticaria is a serious, chronic and distressing skin condition that causes red, swollen, itchy and sometimes painful hives on various parts of the skin. Globally, at any given time, CSU is anywhere between 0.5 to 1% of people. The skin condition is so common that I get almost 5 to 7 patients every day walking into my chamber with chronic urticaria. It presents itself as hives on the body, which happen spontaneously and can last for few minutes to few hours. We call CSU chronic spontaneous urticaria when the symptoms of urticaria last for more than 6 weeks, meaning person is keeping on getting urticaria continuously for more than 6 weeks. Otherwise, we call it urticaria, which is temporary, which may last for a few days and goes away. So answering the question, what is CSU? CSU is a condition in which urticaria is continuously happening for more than 6 weeks. It can happen spontaneously, or it can happen because of some external or unknown factor. When we don't know what the external factor is, it is called chronic spontaneous urticaria. The cause of chronic spontaneous urticaria is not known. There are various theories. Some people relate it to infections like chronic infections like hepatitis B, hepatitis C, to stomach infections like Helicobacterium pylori, to various parasitic infections. Some people relate it to autoimmune diseases like connective tissue disorders, SLE, dermatomyositis, rheumatoid arthritis, to various endocrine disorders like thyroiditis, hypothyroidism, Graves' disease, to various drugs. Having said that, we still don't know what the cause is, and therefore some people also relate it to various allergies to food, allergies to various substances, even malignancies have been reported to cause chronic spontaneous urticaria. Since the exact cause is not known, there is always a search for the cause in the patient to find out what is causing urticaria in a particular patient. It is very essential that when a patient comes with urticaria, a detailed history is very, very important, because unless we take a detailed history as to what exactly is the trigger in one patient, we cannot identify what is the cause. So the treatment will actually depend upon what has triggered urticaria in a particular patient. So it is important that an individual patient is given enough time in a consultation to find out what a particular trigger is in a particular patient. Any person, any child, any adult, any man, woman are all prone to develop urticaria, though women are probably 2 times more likely to develop urticaria than men. Usually it starts between the age of 20 to 40 years, and various studies show that at any point of time 1 to 2% patients may be having urticaria. So symptoms of urticaria usually presents as red hives on the body, which can present in any part of the body, typically face, neck, arms, legs, which is extremely itchy, and it can last for a few minutes to few hours. Then it goes away. Sometimes as a complication you can have swelling of the mucous membrane, like you can have a swelling of lips, you can have respiratory distress, that can be a complication, but sometimes these patients are also depressed. They may have lack of sleep, their function may be disturbed, and they can have other complications like lack of attention, anxiety, and other things. When a patient of urticaria walks into your chamber, your ideal goal is to find out what is causing urticaria and eliminate the cause. The problem with urticaria is that there are various causes of urticaria, from food to medications to contact allergens to hormonal issues to internal issues to malignancies and so on and so forth. So identifying the cause of urticaria is very, very difficult. One must do common tests. The most common causes of urticaria, one can do few tests, but doing all the tests can be challenging and very expensive for the patient. The other problem is that even if you do all the tests, there is a section of urticaria patients which are chronic idiopathic urticaria where there is no particular cause, and therefore it is very, very difficult to find out the exact cause of urticaria. So it is important that when a patient walks into your chamber, you must give enough time of evaluating the history as to what is a particular trigger in that patient. And also there can be certain tests done like serum IgE, certain food allergen testing, and that can be added if that can be identified as one of the triggers. So the mainstay in treatment of urticaria is antihistamines. One can choose an antihistamine based on individual preferences or based on the profession of the patient. If the patient is not getting sleep, then a sedating antihistamine would be better. But if a patient is working, then a non-sedative antihistamine is usually chosen. Antihistamines can be taken once a day, twice a day, or even sometimes 3 times a day, depending on the severity of urticaria. If the urticaria is not controlled with an antihistamine, one would like to combine antihistamines, or sometimes even oral steroids can be given. People keep asking how long to take antihistamines. The answer is take till the urticaria lasts, which may range from few months to few years. In case your urticaria is still not going away, now we have a biologic injection called omalizumab, which can be given for severe chronic idiopathic urticaria or chronic spontaneous urticaria, which are 2 injections giving 1 month apart, and this can give sometimes a long-term remission in patients. It is important that one continues the antihistamine even after taking omalizumab for a while before tapering it off. Also, it is essential for people to understand that they should not get impatient with urticaria medicines, like they don't get impatient with their antihypertensives or thyroid or other chronic condition medication. You will grow out of urticaria, but it is required that you symptomatically control it till you grow out of it.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.